Let's talk cervical dilation. I'm Dr. Shauna Mason, an OBGYN practicing in Houston, Texas, who is here to help moms learn more about how their body gets ready for labor and recovers after baby. So the last two videos have been all about cervical thinning. So let's tie that into dilation and explain what it all means. So as our bodies are getting ready for labor, not only does the cervix thin or flatten out, but it also starts to dilate. So when we're not that close to being in labor, the cervix may be a little bit thicker and firm and only just a dimple. We can't feel the baby's head through the cervix right yet. That is what closed means, or fingertip even. So the baby's head is sitting there, and sometimes we can feel the pressure of the baby's head in the vagina around the cervix, but we can't yet feel it through the cervix. So that would be a closed cervix. So first time moms do something a little bit different than subsequent pregnancy. So their cervix gets very thin and just a little bit dilated, even though that signals really good progress. So if it's your first baby and your doctor says your cervix is really thin, but only 1 centimeter, don't be discouraged. That's actually a really good sign that your body's doing everything we need it to. So baby's sitting on top, cervix is very thin, and we can see the baby's head through that cervix, and your doctor can feel the baby's head along with the baby's water bag there. Okay, so what we see with subsequent pregnancies, so not first babies, we'll see maybe a little more dilation, but a longer cervix. And still you can tell kind of thick consistency there to the edge of the cervix. So it doesn't feel stretchy, still feels kind of firm, but we can get almost two fingers in there, which would be about 2 centimeters dilated. Some people might give you a 3 on that one, but so you can see the baby's head through the cervix there. We can feel it. But we can't quite stretch the cervix any further. As things continue to progress, the cervix will thin out. This is more like 3 centimeters, right? Comfortably put 2 fingers in there and a little room to go. That's a good 3 right there, and a very thin cervix, not a whole lot of consistency there. This is what we see if this is maybe your 4th baby or more, that you can be quite dilated, 4, almost 5 centimeters in this case. Still a lot of consistency there. So think about the baby sitting on top of it. We're quite dilated, which you would think maybe gonna be in labor anytime soon, but still having a lot of cervix there, hard to predict. This though, this is good, right? We are super dilated here, 5, maybe even 6 centimeters, and just a little rim of cervix left. So this is definitely when we would feel like things are transitioning into a more active labor. So this is dilation. This is how we measure it, and this is what it feels like in your body, and this is what your doctor means when they tell you how dilated you are.